Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Ada Kumar. She's joining us here from Horizon Therapeutics to talk about some recent findings from the publication Rheumatology that showed an urgent need for high-quality studies of patients hospitalized for gout flares. Welcome to Health Professional Radio, Dr. Kumar. Thank you for joining us.
Thank you for having me.
Well, give our listeners a bit of your professional background and talk briefly about your role at Horizon Therapeutics.
Sure, thank you. So I am currently a medical director in medical affairs at Horizon Therapeutics. I've been at Horizon for approximately 3 years, and prior to joining Horizon, I practiced radiology for almost 15 years in both academic and private practice settings. At Horizon, I apply my training in radiology in my role as both a scientist and an educator, helping fellow physicians and patients around the country understand the intricacies of gout and debunking some of the common myths about gout, both in terms of disease state and appropriate gout management. My focus has been on emerging research, particularly on new ways imaging can create impactful changes for diagnosing and monitoring treatment for a variety of diseases, including gout.
What is it about gout that attracted you?
So gout, unfortunately, is a very mismanaged disease. It is the most common inflammatory arthropathy in the United States. However, it oftentimes isn't treated or isn't viewed the same as maybe some other inflammatory arthropathies like rheumatoid arthritis and psoriatic arthropathy. And therefore, these patients oftentimes are not managed appropriately. And that's really what this article in Rheumatology showed us, that there really is an urgent need for more prospective or high-quality studies in patients that are being hospitalized for gout.
Being improperly managed as a disease, are we talking people that are diagnosed, they're at home living their lives with gout and they're not being compliant with certain treatments or medications, or are we talking about people that are actually in the hospital who aren't being managed properly in the hospital setting?
Unfortunately, it's a combination of both. Mm-hmm. And so oftentimes our patients with gout, really the goal needs to be to lower uric acid levels. And gout is caused by urate deposits. Urate deposits can occur in the joints, which is how we traditionally think of gout. But we also now know through advanced imaging techniques that urate deposition is occurring throughout the body. It's occurring within the kidneys, the spine, even your coronary arteries. And understanding this to both patients and clinicians is very important. And because a lot of patients and clinicians both believe that really gout is only active during a gout flare. So what's a gout flare? A gout flare is when patients present with oftentimes very severe and debilitating joint pain. And that's really when patients come to the physician's office, they're in pain. This is oftentimes when patients are started on therapy. But unfortunately, a lot of times patients are started on therapy that really is just an anti-inflammatory medication. So it's to control the pain of the gout flare. And they're not really treated to address the underlying cause of the gout flare, which is uric acid buildup or urate deposits. And so it's really important to see appropriate specialists to make sure patients are put on appropriate care. So someone like a rheumatologist, they have specific training to treat things like gout. And this article, for example, did show that patients who see a rheumatologist not only are more likely to have consistent follow-ups to manage their gout, but they are more frequently using urate-lowering therapies, which is really important, again, when we think about the appropriate long-term management in gout patients and the goal of management of gout patients, which is lowering uric acid levels and removing urate deposits throughout the body.
How much of this improvement in treatment is dependent on physicians becoming more aware about gout and the patient becoming more aware of whom to ask what questions to?
So that's very important. That's really the key. Education is always the key. And so when we first talk about clinicians, it's important for clinicians to understand that gout is not just an intermittent disease of the joints manifested by gout flares, and that's really when patients need to be treated, but rather it's a chronic disease of systemic urate deposition, which is causing damage even when patients do not have gout flares. And imaging has shown us that urate deposition persists even despite gout flares, and that urate deposition is causing bone erosions and adjacent damage to organs wherever it's depositing. In terms of patients, it's very important to educate patients on their disease and appropriate gout treatment. So gout management can be tricky because of the way the disease manifests. Again, we said oftentimes it manifests with these flares characterized by severe joint pain. And then following these flares, patients are asymptomatic. So again, there's this misconception that if there's no symptoms, then the gout is under control. But we now know through imaging that's simply not the case. Patient education is also important, since often when urate-lowering therapies are started, there's mobilization of urate, which may actually induce more gout flares. So the patient often interprets this as the medication as not working, or simply chooses to stop since the flares are so painful. So it's important to educate the patient and make them aware that, yes, while there might be more gout flares initially when you're on a urate-lowering therapy, over the course of time, the number of flares will decrease. And once the urate deposits are completely gone, which is the goal, then there should really be no more gout flares, which can eliminate hospitalizations and ultimately improve a patient's quality of life.
With the healthcare system being overwhelmed, especially now, how does the clinician, find the time to adequately educate the patient while they're visiting with so many other things that they have responsibilities for outside of the visit?
Well, the hospital really is a great time, actually, for clinicians to educate patients on gout, its severity, and how to treat it. And while in the hospital, patients tend to really better understand the severity of the situation and can make them more receptive to the teachings of a physician. In addition, when the patient is there, they're a captive audience. They don't have anywhere else to go, so they're really inclined to listen to the physician. The hospital might be the first time a patient encounters a gout specialist or a rheumatologist, which may be consulted. And that's important to make this initial connection with this type of subspecialist who can then continue long-term management, proactively treating gout and educating on appropriate therapies that, again, can combat the underlying issue of elevated uric acid levels to prevent future hospitalizations.
How is Horizon Therapeutics helping the gout community through ongoing studies?
Sure. Horizon is committed to discovering and delivering new solutions for people living with uncontrolled gout. We'll continue to investigate in our medications for uncontrolled gout to increase its benefit and improve the experience for patients, including current research to evaluate the use of immunomodulating therapies to help more patients get a complete response. Additionally, Horizon works with leading experts to change how gout is perceived through research by showing the impact of uric acid buildup in the body and its link to cardiovascular, kidney, and other serious diseases. So Horizon's really going beyond providing therapies by engaging with the community to listen, to learn, and provide support to improve experiences for people living with uncontrolled gout and their families. As part of the educational effort, I personally host a podcast series on systemic urate deposition and discuss practical steps for identifying it in patients, including advanced imaging techniques that can show urate buildup throughout the body. And this series is available at evolutionofgout.com. So we really strive at Horizon to make powerful differences for patients, their caregivers, and their clinicians every day.
Well, I have enjoyed speaking with you this morning. Thank you so much for joining us here on Health Professional Radio. Once again, that website that you cited for us?
evolutionofgout.com.
Well, Dr. Kumar, again, thank you for joining us here on Health Professional Radio this morning.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ada Kumar, Medical Director in Medical Affairs at Horizon Therapeutics. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.